hypotension or low blood pressure. Welcome to Talking with Docs. I'm Dr. Bradley.
And I'm Dr. Paul Zalzal.
And I'm Mike Heffernan.
Okay, Dr. Heffernan has joined us again today. He's one of our cardiology guests. People love the information that he provides. We're talking about low blood pressure, which is quite common, and a lot of people are worried about it, but it's not as worrisome as high blood pressure, which is way more pervasive. So we're going to talk exactly what it is and why it matters, or maybe why it doesn't matter quite so much.
So, low blood pressure.
Low blood pressure.
You know, did you see my eyes rolling there a little bit? So it's common.
Okay.
And it's common in young individuals.
Okay.
Let's go back a step.
Okay.
So people can have low blood pressure for a variety of reasons. Some of them are bad.
Sure.
Okay. So let's do the bad ones first, and then we'll get to normal. So
Acute low blood pressure in a setting of trauma.
I think that's where he's going.
Also known as shock.
we're sitting in an operating room here. You guys are familiar with low blood
Cardiogenic
pressure,
shock.
or you might deal that off to the anesthetist, I suspect.
Yes.
Yeah.
Yep.
That's an issue.
Okay, so low blood pressure, cardiac causes,
Yep.
so a fast heartbeat or a terribly slow heartbeat.
Right.
Those can cause low blood pressure. There are cardiac conditions, so previous big heart attack or in the middle of a big heart attack, low blood pressure. Maybe some valve problems with the heart where the valves aren't opening well,
Right.
and you can't get enough, forward flow, low blood pressure. There's bleeding. So there's bleeding or not enough fluid intake, or diarrhea, nausea, vomiting. So there's a lot of medical conditions that can cause low blood pressure. A big blood clot in the lungs, low blood pressure.
Right.
And then there's some other neurological conditions where the adrenaline system in the body, the autonomic nervous system doesn't work well. So those are all a series of kind of bad things that's going through a cardiologist's mind when somebody comes in with low blood pressure. What do I need to sort out?
And those would be sort of a change in blood pressure. I mean, and in the absence of a congenital issue, those would be people who had a normal blood pressure. Now they've developed a low blood pressure because of one of these issues.
Right.
And so that's a change in your blood pressure. Normally you're sitting at 120/80. All of a sudden things have dropped off.
Yep.
That could be caused by something pathologic leading to that.
Absolutely.
And would you agree that the three main contributors to your blood pressure would be your blood volume, your blood vessel tension, as well as your heart rate? Would you say that those are three fair categories that all contribute?
I think that's fair.
Okay.
I think that's fair. And there's a thing called stroke volume. So how much blood does your heart push out with every heartbeat?
Okay.
And there's this thing in medicine actually. So just to
In
be
medicine,
fair,
he looks at us like we're not in medicine. That was awesome.
well, you're surgeons.
That's right. In medicine.
It's good.
Two hardest years for school and a surgeon.
It's so good. Yeah. So good.
Grade 4.
Yeah, so good. Wait, say that again. I missed that one.
The two hardest years in school for a surgeon. Grade 4.
Grade 4.
That's terrible.
Twice.
2 years.
You know that people
can
nowadays
pick up-
actually don't fail, so it's actually not true anymore.
Yeah. That's awesome.
So J curves.
four
We
was
didn't talk
tricky.
about J curves for.
Okay.
So there's this thing in medicine in a variety of conditions called a J curve. So the curve kind of goes like this.
Yeah.
So hypertension or hypotension is a pretty classic one. High blood pressure is bad. You go up that J, bad things happen.
Right.
You go down, there's a sweet spot.
Right.
But if the blood pressure gets too low, also bad things start to happen again.
Okay.
And same with blood sugars and that sort of thing as well. So now low blood pressure, that's not from any of those bad things. Common in young individuals, young women in particular.
Right, like late teens, early 20s kind of talking, right?
So we're talking about blood pressures that usually sit in the 90s. So 90 millimeters of mercury, 90 over 70, 90 over 60. They do well, so generally do absolutely fine, but they run a blood pressure that sits around 90 or maybe 85. But you get a little bit dehydrated. And it doesn't take much to bump it down. And when the blood pressure goes down a little bit, then not enough blood goes up to the brain, and it's easy to get lightheaded then. And in the worst case scenario, you've passed out for a moment or two.
Okay, so that other than that situation, generally walking around with a low blood pressure like that is okay.
As long as you're asymptomatic, so as long as you don't feel
dizzy,
your low blood pressure, you're dizzy, lightheaded,
passing out.
Or you're a giraffe. You'll never get the blood.
And you never know. So there are some lifestyle things we talk to people about because it's not uncommon for them to feel symptoms, especially in the summertime if it's hot, or if they're exercising and they're physically active and they get dehydrated. So we talk to those individuals about, maintain your hydration.
Yep.
Often maybe a sports beverage a day or electrolyte containing beverage a day. The sports beverage or the salts in there bump up your blood pressure a little bit.
Okay.
We tell these people, unlike all the others in the office, that you can be liberal with your salt intake.
Right.
We don't want them to eat junk.
Right.
But chicken noodle soup, maybe an OXO cube in some hot water,
Okay.
things like that bump up. That will bump up the blood pressure, so they're less likely to be.
Because we just made a video about how bad salt is.
Yeah. So.
But we know that for a certain population,
It's okay.
Yeah. Now, when they come in, after you examine them, you do a history and you do physical examination. Typically, are they going to even get any investigations? Like, is this someone that requires an echocardiogram or an EKG or anything like that?
No.
Usually not, right?
No. Usually the history and the physical is more than enough.
Right.
Yeah.
Okay.
Just keep Top Gun Maverick playing in the background and then check the pressure again. That's like an intense adrenaline movie.
It is.
Have you seen it?
I only saw the first half so far.
First half.
I was just too busy.
You're getting too stressed out. And blood pressure got too high.
Right. Okay. So this is really important. So if you do have low blood pressure that is asymptomatic, so you're taking your pressure at home, but you're worried about it, you probably can stop worrying. But if you are lightheaded, if you are dizzy, then you can go see your doctor to talk about whether or not this is something that's more serious, which is unlikely, but treatable with easy remedies like fluid and salts.
Or if you've been cruising along with a normal blood pressure, even a little hypertensive, high blood pressure, then all of a sudden it goes low, don't think, oh, it's my lucky day, my blood pressure is good now. That could be an issue as well.
Right, but long term, generally it's safe. So I think this is a really important take home message. If you like this video, please like it, subscribe to our channel.
I'm going to go home and check my grade 4 report card to see what you're talking about here. Remember, you are in charge of your own health.
We'll see you next time.
Thanks, Dr. Heffernan.
My pleasure.